what we talked about today is identifying those patients at risk for progression to the more advanced forms such as steatohepatitis and liver fibrosis. What I showed today is that the most impactful risk factor for the development of MAFLD and MASH with fibrosis is type 2 diabetes. So in addition, obesity, and especially if you have obesity with at least 2 other comorbidities or metabolic risk factors, these patients need to be screened for the presence of MAFLD with fibrosis. We discussed the algorithm that is adopted now by all the current guidelines, including the American Gastroenterology Association, the American Association of Clinical Endocrinologists, as well as the American Association for the Study of Liver Disease, and walk the audience through the algorithm for screening for liver fibrosis. Why is it important to screen for liver fibrosis? We know that the liver fibrosis predicts outcomes such as mortality. The other message that I want to convey is not only to screen, but also to treat. And why is that? It's because today we have tools that we can use in these patients. So once you identify these patients and you risk stratify them by using the algorithm, by using tools such as STEAP4 and elastography or ELF, then you can choose the right treatment tools. And the treatments that are available are incretin hormones, such as GLP-1 receptor agonist or GLP-GIP dual agonist that have shown to achieve the highest rate of MASH resolution in these patients. In addition, we have the first FDA-approved drug for the treatment of advanced MASH with liver fibrosis. This drug is resmetirom. This was approved just recently in March of 2024 and is available as of this month in pharmacies. So this is exciting times for MAFLD MASH, especially with the new development in the pharmacotherapy field.